people, and it's gone on far too long.
Thanks very much, Reverend Barber. It's been a real pleasure to work with the House Justice Committee and with a brilliant group of young scholar activists. I'm going to comment about the Opening Up America strategy, if I can call it that, from a public health perspective. But the key thing, of course, is that public health is part of our daily lives. And you're going to hear from people whose everyday lives are testimony to the recklessness of the plan that we have in front of us now. It's hard to remember that the first person who died of COVID-19 was announced at the end of February of this year. So here we go, March, April, into May, approaching 85,000 lives lost in a response that couldn't have been more bungled. And now on April 30th, the president decided not to renew the federal guidelines on flattening the curve and reducing spread, and has left it to the states. And now many states, most states, are proceeding with reopening. Now, reopening has to happen, but it has to happen in a way that is responsible and that protects people. And of the states that are reopening, the majority don't even meet the White House very simple and probably too reckless guidelines. For example, the reason that everything was shut down was to bring down the number of new cases. And over half of the states that are reopening, including the state of Georgia, which jumped the gun and started reopening even before April 30th. And by the way, also is a state where a young man out jogging was shot dead by two people who didn't think he should be there. But Georgia has increasing cases, as do most of the states that are reopening. To reopen, certain things have to be in place. You have to have the number of cases going down. You have to have the ability to diagnose new cases with testing. And the ability to put testing in place has been something that the United States has failed to do from the outset. The president, I believe, has been bragging that the US tests more people than any other country. But when you look at this as tests per population, the United States has some 20 countries above it, including countries like Spain, Germany, are testing more than the United States is, and the testing remains inadequate. Then you have to be able to act on that testing. You don't do testing just for the sake of testing. And parenthetically, the White House has tons of testing. And nonetheless, testing alone is not enough because people have to have a way to stay safe from COVID. And they have to have the ability to isolate and to, if necessary, contacts to be quarantined. And that doesn't exist. You've already heard of how people work in situations where they simply have to continue working even if they don't feel well because they have to put food on the table and pay the rent. They don't have sick leave, they don't have health insurance. So that the ability for people to get a test remains woefully inadequate, and the ability to act on tests remains woefully inadequate. And as the economy opens up, we have every reason to believe that the number of cases will begin to increase, because when people have contact with other people, they are at higher risk of infection. Now, this will be people who already are bearing an excess burden of risk of COVID-19, low-income essential workers who are disproportionately Black, Latino, immigrants. These will be the people And we stand a risk of not only replicating, but amplifying the terrible disparities that COVID brought to us, on top of the existing deep and enduring chances of a variation in chances for a healthy life across our population. In order to ensure that we're safe, yes, we need to have adequate testing. Yes, we have to have the ability to provide care for people who need to be isolated, even alternative housing if you live in a household that's too crowded, and many households in the US are crowded. The ability to go stay somewhere else. Yes, we need people to have the ability to get health care, but we also need to tackle the underlying factors that made us so vulnerable in the first place. That includes things like ensuring that people have a living wage, that they can stay home when they're sick because they have paid sick leave, that they have health insurance so that they don't avoid going to the doctor for fear of the bill, something that even people who have health insurance may be fearful of. And of course, anyone who doesn't, our healthcare is astronomically expensive. Additional protections are needed in certain settings, and that means personal protective equipment in nursing homes and warehouses, not just for health workers, but for all of the frontline workers who have continued to take our economy and keep it going. We don't need to guess whether or not COVID resurgences may occur. We already know this from the cities in Asia that are further along in confronting COVID than the United States. These were countries like Wuhan, which brought its case rate down to zero, they thought, and then faced importation of cases, and now has got a plan to test 11 million people in order to contain that resurgence. The United States has not a single jurisdiction which has the capacity to contain a resurgence on that level. It may not even have the capacity to identify a resurgence. So this is reckless policy that builds on a reckless response. And I know that people want to protect themselves and their families, and that when they can, they will take action to do that. What we don't need is people placed in the impossible position of risking their own health or the health of their households because they can't afford not to. So these guidelines are now being determined one state at a time, a patchwork of chaotic response that has so far cost us many tens of thousands of lives and will likely cost us many more. You know, I often get this feeling that people, you can't see a virus. It's invisible and it spreads silently, but it is not imaginary. We have to use the public health tools at our disposal to bring this under control, and wishing it away will only cost more lives. Thank you.
Somebody's hurting our people, and it's gone on far too long, and we won't